Unfortunately, it's a trend in healthcare right now.
And now the trend is impacting care for Central Illinois patients. Good evening, I'm Brendan Morano.
And I'm Jennifer Roscoe. Last night we told you Memorial Health System laid off hundreds of people in leadership and administrative roles. Now we have new information on the impact of those layoffs. WCIA3's Theodora Coulivares is live outside of Memorial Health in Springfield. Theodora, tell us, what did you learn today?
Well, Jennifer, these layoffs will result in at least some reduction of care in the Jacksonville area. Memorial Health officials just confirmed the transitional care unit at the Jacksonville facility will be closing next month. That facility is meant to help people go from an intense stay at a hospital to getting ready to go home. Memorial Health cut hundreds of people from its workforce, specifically people in leadership and administrative roles at their facilities. They say it's because of economic trends hurting the healthcare industry. In a statement, Memorial Health's president and CEO said, quote, "This is a difficult decision that was made after careful analysis and implementation of other cost-saving measures. Memorial Health is not immune to national trends, such as rising costs of supplies and equipment, high cost of temporary labor, and shifting trends in payer reimbursements." The problem Memorial Health is facing is not an isolated one. After the pandemic, healthcare organizations across the country are dealing with rising costs, specifically related to labor.
But their business model is such that they depend on reimbursement rates, and those reimbursement rates are not adjusting as quickly as the costs are.
About 20% of Memorial's leadership positions were let go. That's about 5% of the system's total salary and benefits being cut.
Cuts that they made are difficult, and I'm sure very difficult for the families impacted. What we hope is that these short-term adjustments allow their long-term fiscal future to be good, that we keep them around in our community for a long time.
Despite many being out of a job, Ryan McCready with the Springfield Sangamon Growth Alliance is hopeful people who were laid off will find work in the industry.
The good news about working in the healthcare industry is there's still a tremendous demand for those skill sets. And so I feel that the opportunities for those individuals to reemploy are good in our community.
A spokesperson for Memorial Health says the TCU in Jacksonville will close by September 30th. In a statement, they said, quote, "The Jacksonville community has multiple resources offering similar types of transitional healthcare services, and JMH will continue to assist patients and families in finding appropriate post-discharge care." Reporting live in Springfield, I'm Theodora Coulivares, WCIA3, your local news leader.
Thanks for that follow-up, Theodora.